Hello guys, so we have a case presentation for the eyebrow transplant and peri-orbital rejuvenation. So this particular lady, very nice, around 60 years old, and as you can see in a picture, she was barely having any hairs on the eyebrow. Eyebrow is something which is very important for any female or even for the males, but specifically for the female, when they do not have a proper thick eyebrow, they actually lose their self-confidence. And in India specifically, people think that you are probably a patient of cancer or you have some major disease, and people may ask you a lot of questions when you meet them in person. So even the same issue happened with this particular lady. She was really upset when she was not having a eyebrow and eyebrow hair. The reason for that was nothing specific. She is not having any major illness. She is not having any medicines for the cancer or anything like that. But she lost all the eyebrow hair. At the same time, you can see there is a lot of lethargic looking face, or there is lot of sagging on the upper eyelid. So we decided to go for an eyebrow transplant for her, as well as the upper eyelid blepharoplasty. So what is upper eyelid blepharoplasty? It's very simple. You remove the excess skin and fat pad which is making your eye looks older. So that is a blepharoplasty. And what is an eyebrow transplant? As the name suggests, we take out a hair from the scalp and we put it into the eyebrow. So you start getting a hair on an eyebrow. So that is the eyebrow hair transplantation. Both the procedure can be done under the local anesthesia. Both the procedure can be done in a daycare procedures, and we have done both the procedure together for her, because in the same area you have to just give local anesthesia once to the patient. Now the picture which you can see is immediately after the surgery. So first of all, we have given some specific outline to her eyebrow. We have designed her eyebrow. It is very important that you take a good care of the direction and the angle whenever you are doing an eyebrow transplant, because it should look like a natural eyebrow. It should not look like a scalp hair is put up there. Second most important thing in an eyebrow transplant is you have to make sure that all the graft which you are implanting should be of a single follicular. In eyebrow we just have a one hair, so all graft like one hair, all the eyebrow hair is a one single unit which comes out. So it is very important that you put all the single follicular unit graft there, okay, and not the multiple like when you take out a scalp graft, you may have a 2-3 hair follicle in a one graft, so you have to separate it outside and then you have to implant. And the eyebrow, in a center or near the nose, in a midline, it is towards the scalp, then it goes towards the ear, and at the last it goes towards the angle of the mandible. So in a proximal 1/3, the direction of the hair shaft is different. In middle 1/3 it is different. So that you have to take care, whenever you are doing a eyebrow transplant for the patient. And this is just immediately after the surgery. The bandage what you can see on a patient, that is for the donor area. And we have tried to give her a natural look. We do not want her to look extraordinarily young or something, but we want her to look presentable, and that was her requirement. She never demanded to look extraordinarily beautiful or anything like that. Her demand was that I should be acceptable into the society. So I think that is very reasonable expectation. And we have done the eyebrow transplant. We have used more than some 400-500 graft, and we have removed the skin, and the suture is put up for the blepharoplasty, the 6-ethanol. And now the picture what you can see is the before after of the eyebrow transplant, where you can appreciate patient is having a very crisp eyebrow. She is looking very pretty, and she herself was very confident even after the surgery. At the same time, you can see the lethargicness on her eye is less. That is because of the blepharoplasty. So she gives the appearance of a very much young woman. Okay, and this pictures, what you can see, the before after is just after the 3 weeks of a surgery, not much, and there is barely any visible scar present on a eyelid. And these are the few before after which you can see. So that is all about the eyebrow transplant in Mumbai in India. I myself is Dr. Vaibhav Shah. I'm basically a maxillofacial surgeon. I just take care of the facial cosmetic surgeries, facial feminization surgery, hair restoration, eyebrow transplant, beard, mustache transplant. That's it. My clinic is in Borivali, Mumbai, India. If you have any questions regarding your face, you have any doubts regarding your eyebrow, you have any queries, for any of this procedure which is related to the face, please feel free to approach us. Okay, we'll be more than happy to assist you in the best possible way what we can. Thank you.